Okay, let's discuss about the part 4 of RGB contact lens fitting. So we are going to discuss about the characteristics of optimal tight fitting or loose fitting. So I'm going to discuss in one slide. Okay, so in this slide, this is optimal and this is tight fitting and this is loose fitting, and we are definitely going to contrast it. Okay, so we are going to contrast it with one another. So for central, mid periphery, and edge width and edge clearance, these are static fitting. Yes, and then others are dynamic fitting. For static fitting, center, for optimal fitting, center is slightly central light touch, and then tight fitting, there is definitely excessive central, not bearing, but it's wrong actually. It's not bearing, but central excessive pulling. Yes, but at the same time, mid periphery, tight fitting, heavy bearing. Yes, for example, in this picture, let's I think in this picture, see here, center is heavily pulled, at the same time mid periphery heavy bearing, and the edge is extremely thin. But in case of flat fitting, this is flat fitting, this is stiff fitting. In flat fitting, center touch heavily is there black, and then edge is extremely light. It means actually there is large edge lift, edge clearance. Yes, so edge width is also very large, and in between those is optimal fitting. Center is slightly touch and mid periphery is slightly bearing, and edge clearance is adequate. So this is the picture. So that's what I'm talking about. In mid periphery properly aligned in case of optimal fitting, and in case of loose fitting, poor alignment. But mid periphery is always less definitive point of view, less defined area, but edge width and edge clearance both are very important. In case of optimal, ideal. In case of tight, definitely very narrow edge width, and in case of loose, edge width is excessive wide. Edge clearance again same, average for optimal, and edge clearance is very reduced or minimal in case of tight fitting, but in case of loose fitting, excessive. If this excessive is even higher, then you can see bubble there. Yeah, for tear extensions, for adequate in optimal, at the same time for tight fitting is poor, seal off. But in case of loose fitting, excessive tear extents, and sometimes you can see bubble, air bubble. Yes, decentration, it's very similar in tight fitting, and optimal fitting is centered, but in case of loose fitting it's definitely decentered, greater than 0.5 mm. Stability is stable but is stuck in case of tight fitting, but optimal fitting is stable definitely. Loose fitting is always unstable no matter what, soft contact lens or RGB contact lens. Lid position is interesting in tight fitting. Superior lid is covered but fixed. Definitely loose fitting, there is no lid coverage, and sometimes it ride high contact lens, sometimes it ride low. Yes, definitely in optimal superior lid attachment, which is very good. For optimal contact lens fitting, good contact lens fitting is vertical movement is 1 to 2 mm. Yeah, smooth vertical movement in 1 to 2 mm, but at the same time tight fitting movement is restricted and less than 1 mm. In excessive, it's like really devastating, greater than 2 mm rotation, and there is huge sensation. So in case of fluorescent pattern, central alignment and minimum edge clearance is optimal, but definitely in the tight fitting, central is pulling, mid periphery heavy wearing, and edge clearance is very small. In case of loose fitting, central touch, excessive edge pulling. In the edge, there is, you can see huge amount of fluorescence. So for comfort, that's very important point. Optimal is good after adaptation for a long time. Yes, but tight initially it is comfortable, but it will show its own color after some times. Basically means tight fitting contact lens will be difficult after some times, like for example after 1 2 hours out. But loose fitting, it's awareness with the movement, and it's from the very first beginning it's difficult for the patients. Okay, that's the main characteristics of optimal fitting, tight fitting and loose fitting. So for loose fitting you don't worry about it, but for optimal and tight fitting you have to distinguish between these two, because this, there is the problem distinguishing between optimal and tight sometimes. Yes, so it's like many things are similar, but yes, you have to distinguish between these two. Loose fitting patient will tell you that it's difficult. So and there is less chance that you will have problem encountering with loose fitting. Okay, fine. So I have already discussed about this figure. So we have to do over refraction, which is very very simple in case of every single RGB contact lens, no matter what it's scleral lens, no matter what it's orthokeratology lens, no matter what it's corneal lens. Okay, in every single rigid gas permeable contact lens, you will do over refraction, and this should be performed with the patient wearing contact lens, definitely with BOZR nearest to correcting possible, obviously. And the contact lens over refraction is meant of checking the fit, because the exact alignment of the liquid lens power is 0, and over refraction plus the power of the trial contact lens is equal to the ocular refraction. So basically means whenever we put RGB contact lens, there will be tear lens, and the tear lens will act as a separate entity, and we have to take that tear lens into account. That's why over refraction is must. So it's over refraction is one of the great skill in case of scleral lens, no matter what, in case of orthokeratology or in case of RGPs contact lens. Because of the tear lens, over refraction is central important procedure you have to perform. Okay, obviously we know SAM and FAP rule. Yes, so basically means less negative, more positive. Negative fluid lens, whenever there is negative fluid lens, what it causes, it is basically in flat fitting. So in flat fitting, what do we do? In case of flat fitting, what we do, SAM or FAP, basically lens is negative, so it means flat fitting, FAP, sorry, flat fitting add positive, sorry, FAP, flat fitting add positive, yes, because tear lens is negative, so it's FAP rule. And stiff fitting add negative, so stick fitting add negative, yes, stiff fitting add negative, because from stick fitting positive lens is there, positive liquid lens is there. So I think we have already covered this topic. Yes, so in summary, even a small improvement in RGB fitting influence the wearing comfort significantly, because it's very important. Even a small improvement in RGB fit will definitely create good comfort. First, perform the pre-fitting examination, include discussion, refraction, and all these things. Then note the external factor that may affect the lens fit for position, such as lid position, tear flow, and all these things, and measure SVID for definite lateral diameter. Then insert the nearest, you have to understand, you have to insert the nearest trial lens, okay, nearest possible trial lens, which is actually same with the contact lens we are going to prescribe, which is nearest possible trial lens we have to insert into the patient's eye. If the calculated BOZR is not available, go to the next slightly steeper lens, as slightly steep fit is easiest to assess than flat fit. It's obvious. If you do not have the calculated BOZR in your trial lens, then it's always better go with the next slight steeper lens. Don't go with the flatter lens. Okay, because for a steeper lens it's always easier to assess, because flatter lens it is even difficult for your patients. So that's you have to take into account. This point is very helpful tip, clinical tip for you. And examines the lens fit, definitely. Then the positioner and the fit should be noted both with lead manipulation and then using lead on the center. So basically what I am talking about is whenever you insert the contact lens into patient's eye and then you let the patient for that adaptation period to stay calmly, and that adaptation period went, then you, when doing examinations, for example dynamic and static fitting or whatever, at that particular examination section you have to understand, you will examine in two ways. One, you let the contact lens influenced by the upper lid, definitely by both lid, and you will examine by removing that both lid, by actually separating both lid and the contact lens alone with the cornea. That's better way. Okay, you will do both ways. Okay, so it is expected that the lens will center naturally with adaptation and settling. Modify BOZR until the barest trace of the fluorescence is visible centrally, because centrally we want feather touch. Yes, Once the ideal BOZ has been determined, carry out an over refraction definitely. First we will do fitting, then we will do over refraction and all these things. Yes, repeat for the other eye or the order the final. So I'm going to discuss about few things that we have already covered just for the summary. Okay, so I'll talk about the force first. So there are seven types of force we have discussed about: gravity, tear film capillary force, tear surface is meniscus force, eyelid force, viscous force, hydrostatic pressure force, and torque or moment of balance force. I want you to pause the video and see these things for the summary. Okay. Then again, these are the things which is important for what do you call the design of the contact lens. Yes. So basically, what we were talking about design: total diameter, BOZD, BOZR, which is another name for the base curve, edge lift and edge clearance. Obviously, these are two different things, but we're talking grossly, clinically, same way. Peripheral curves and central thickness, how they are differ, and what happens actually, what effect it gives to the lens fit. Yes, what happens if total diameter is more, we are increasing total diameter, we're increasing BOZD, we're increasing BO ZR and everything. Yes, so it's better you pause the video and you read these things. Okay, it's better. So this is also same, it's like fitting characteristics, like what happens in central stiff fit, flat fit, optimal fit. Okay, in lens movement, what happens in stiff fit, flat fit, optimal fit. Yes, so these are the things that I have tried to incorporate. Okay, so it's pattern, TRX sense, and all these things. Just pause the video and just look at this uh, table, and what you actually find there will be helpful for you. Yeah, so these are the tables that I want to discuss, and I have already discussed about it. Yes, what happens of center of gravity. Yes, with plus lens, definitely it's like 7 times different. Total diameter is main player, as we know, then base curve, then central thickness. What happens if we shift, if we change total diameter from 0.1, then what happens is 7 times in plus, 4.5 times in minus lens. So these are the influencing factors. Yes, definitely I have and definitely these are the uh, Kearney and Hill's data. So you have to understand these things because it's important, and it will definitely come into examinations and all. So this graph is also one of the good table I have taken from this book, Clinical Manual of Contact Lenses. So what are the clinically significant parameter changes? So see, base curve radius. So changes for clinical significance. So we have to change approximately in 0.1 mm to see clinical significance change. So overall diameter or optic zone diameter, we have to change approximately 0.4, overall diameter or 0.3 to change significant clinical significant change. Peripheral curve, we have to change by 0.5 mm. We have to change a bit more. Central thickness for high decay, we have to change by 0.02. So to see exactly significant clinical change. So that's better graph. Yes, I have taken this graph from this book. Again, I have taken from this graph from this book. See, the gas permeable lens diameter selection. What happened? What are the things that, see, palpebral aperture. If palpebral aperture increases, diameter also increases. Yes. If SVID increases, diameter also increases. Yes. Is palpebral aperture. So what are the rough guide? Sorry, pupil size. This is pupil size. What are the rough guides of pupil size? Pupil size plus 3 to 4 mm will be your BOZD. Yes, and BOZD plus 1.2 to 1.4 will be your total diameter. Yes, so this rough idea, you will have rough idea from this particular table. So I have taken this table again from Clinical Manual of Contact Lenses. And base curve of the radius selection, this is very important table. I think it's one of the most important table. See, I have already told you the one of the most important thing that you will select will definitely base curve, BOZR. Yes, so how to select? For we are talking about 9.2 to 9.4 overall diameter lens. How to select is, if Your refractive error do not include astigmatism, especially corneal astigmatism, which is from 0 to 1. Then you don't care about it, you fit on k. On k means flat k. But if your astigmatism, corneal astigmatism, is from 1 to 2, then what you will do, you will do flat k plus this 1.4 into delta. Okay, so that's better way to think about it. And when your cylinder is a little bit higher, up to 3, then you will do one third of the difference of k, and you add to flat k. Just remember, what do you mean by adding flat k? Means flat k in diopter, and whenever you add on the further power, it means you will select a little bit steeper uh, base curve. Okay, you are not going to towards more flatter. That will be wrong. Okay, so if there is greater than 3, that's obvious, we want toric lens. That's better. So that's, again, I have taken this book, this table from the book Clinical Manuals of Contact Lens. This is very good slide. Just stay on this slide and try to understand this whole table by your heart. It is very, very, very good table, and it will help you save your time in your clinical setup. Okay, so that's, I think, last. So for RGB contact lens, I can tell you this is a great book for RGB contact lens. This is the greatest book for RGB contact lens, and definitely I'm in love with Efron Phillips. And in this particular video, I have taken a lot of pictures from first edition icon, which is available in internet too. So these are my references. Okay, so I think that's it for RGB fitting. It's already 4 video. Okay, bis dann, tschüss.